Imagine being called every day with people ringing you up, giving you bad news. So that bad news was something which happened years ago, months ago, a long, long time ago. But you keep getting interrupted. It keeps stopping you in the day and demanding your attention. That not only would you have to hear and be reminded of that thing that happened, and that phone call could be something as simple as a good, well meaningful neighbor or friend just asking you how you're doing. And in order for you to think about that question and give them a genuine reply, means that you have to think about it. And that is just like getting another phone call. But instead of just having a phone call, a lot of these memories come back as images, flashbacks, images in your mind which are right there in your face. So these sounds and these images that pop up inside of your mind, nobody else can see them. Your nervous system reacts accordingly. You trigger off a fight or flight response. The whole panic of the situation, which seems like it's just as real as everyday life, is right there. It feels real and your nervous system is responding correctly. It's no wonder people with post-traumatic stress disorder don't really want to go and see a talking therapist. It's no wonder they avoid opening up and discussing the problem with PTSD. I wouldn't want to talk about it. They can seem distracted, disorganized, tetchy, panicky. Someone with PTSD may seem really weird. The behavior doesn't seem to fit the environment. Because what you can't see from the outside is where their attention is being focused. The nervous system is reacting to images and sounds which are invisible to anybody else from the outside. Now imagine you're having that phone call and every single day of your life, images to remind you of that traumatic event are flashing back inside of your mind. Talking about it, you'd want to avoid that. Your coping strategies would do everything to avoid having to deal with. So the wonderful thing about the IEMT model is it can be done content free. That means that your client doesn't have to discuss it and you can help them resolve those flashback images without them having to put it into words, which is one of the main problems with trying to help people with post-traumatic stress disorder. So the other great thing about the IEMT is that it can be used over Skype. So if you're a therapist who's self-employed, who works at home, then you can deal with your clients overseas, whereas they don't have the extra expense and time and logistic problems of having to come to visit you. The training only takes a couple of days to learn the algorithms, to learn the language patterns. The training course is very experiential. That means that straight away you will have practical skills to start using it. Thanks for listening. I hope I've given you a fun way and an interesting way to get the gist of the problems that people who deal with PTSD on a daily basis have. And hopefully I will see you at one of my training courses soon. Thanks for listening.